As an inmate at the El Paso County Jail in Colorado, Sherman Collins is a diabetic. It's a medical condition that was not only diagnosed here, but also needed to be treated at the correctional facility.
Basically, they put me on this diet plan so that I can have better blood sugar, because my sugar was totally out of whack when I first got here. So
Sherman is not alone. He's one of thousands of inmates nationwide who need regular medical care during incarceration.
We typically run between 1,500 and 1,600 inmates, and anywhere from 20 to 30% of that population is requiring some type of medical care, whether it's in the initial screening or it's a continuation of medication needs, or when you have a population of 1,500 to 1,600 and you have an influenza outbreak.
Historically, health care in jails has been managed and, in some cases, delivered by the deputies or jail staff. But this can create a host of difficulties and inefficiencies, including high liability risks and higher costs.
The concern I have is that if the jail staff is responsible and administers the medical care, it diverts their attention, time, and efforts and responsibilities from the jail security and custody, which then can create a risk and liability issue. And typically, jail staff is not trained in the proper protocols for medical services, if you will, which again creates a high risk and liability for not only the individual, but the sheriff and the county as well.
Number one is staffing is one problem. Finding doctors who are interested and competent in correctional medicine, because it is different.
Most inmates have not had health care, and if they have had health care, it's inconsistent. So there's kind of a kid in a candy store type attitude where, wow, now I can get health care services.
This underlines a growing nationwide problem. Inmate population in the U.S. is growing today at an annual rate of nearly 4%, at a cost of over $3.5 billion a year in health care. Yet the costs associated with providing health care for these inmates has been growing at more than 3 times that rate. With over 2.4 million people incarcerated in facilities nationwide, many believe the time has never been more important to privatize the industry.
Sheriffs were trying to run or trying to hire nurses and run medical departments. They're not trained to do that.
First thing, it provides the backup that they need. In other words, we don't have 24-hour nursing at many facilities, but if they have a problem, you can call. In other words, and I don't have to be a sheriff. I don't have to be a judge. I don't have to be an officer. I can be a doctor. And that's what it is. Division of responsibility. And once again, it works better for everybody. We're all on the same side of the fence. We want to make sure that our inmates stay healthy and that they don't receive any additional problems while they're in. Many of them are sick when they come in. We want to keep them as healthy as possible.
Delivering health care in a correctional facility requires procedures and expertise geared toward the correctional environment. Outsourcing this care to a company that specializes in correctional or inmate health care complements the jail system and can provide quality yet cost-effective medical, dental, and behavioral health services for inmates.
We want to make sure that we're providing that health care to the community standard, and that those tax dollars are being spent wisely and as efficiently as possible.
A lot of times inmates will come into a facility and a lot of them, the majority of them, haven't had health care on the outside ever. They don't ever go see a doctor, they don't have dentists, and they have a lot of health care needs. But what we try to address is their urgent needs that need to be addressed immediately in the facility.
The Douglas County Jail and El Paso County Jail of Colorado are examples of correctional facilities which have outsourced their health care to private companies at a tremendous savings in management costs, as well as an overall increase in standard of care.
I think that's one of the true advantages to relying on experts in the healthcare field. If we rely on law enforcement, we're trained to do what we do, and that's enforce laws, make arrests, clear warrants, build cases, not become medical experts. And there is a lot of manipulation, and sometimes it's for negative consequences or for possibly escape. And that's where we can rely on people in the industry that understand the manipulation, they've seen it before, and they can truly assess the medical needs and make sure that the treatment given matches those needs.
By bringing in professional medical staff in a correctional setting, that's their job, then it takes the risk and liability off the deputy sheriff who's working the shift, the sheriff, and the county as a whole.
It's important you give respect, you get respect, and it's very important in the correctional setting. When they're in our facility, they're under our care and my care specifically, so they will get the best care that they can under the circumstances. They get good, solid, basic care.
Running a jail is complex enough without inmate health care added to the system. Managed health care from a partner like correctional healthcare companies can not only help control costs, but also provide the quality health care needed by the nation's growing inmate population. Inmate population is a growing problem in America, and as more and more individuals are being incarcerated, the management of inmate health care is beyond the expertise of the jail staff. That's where Correctional Healthcare Companies, a physician-managed company, becomes the perfect partner.
We feel that we're in the best position to know health care and manage health care, not just inside the walls of the facility, but when the inmate clients need services outside the walls of the facility in the community.
As a parent to healthcare companies Correctional Healthcare Management and Health Professionals Limited, Correctional Healthcare Companies is dedicated to providing quality healthcare for inmates at an affordable cost.
The reputation of providing quality inmate healthcare services at a quality, cost-effective price was something that both of our companies did very, very well, so it was a very good match.
The sum became better than each part, and there's no question about that. It's made a big difference in every entity of this company because we brought the strongest parts of each one together.
Offering 24/7 medical, dental, and mental health care for inmates, the CHC has now partnered with more than 200 facilities nationwide to provide quality health care, help control costs, and limit liabilities. It has also established a special HIV program and a continuation of care plan for inmates once they leave the correctional environment.
You're delegating that responsibility to people that have been trained, educated, and are experts in the field. And that's something that I think not only benefits us from a liability perspective, but also an operational.
Having been a former jail commander and a former sheriff and running a county jail, if you will, the partnership has been very significant for the overall operations for the county jail and the county as a whole. I have personally witnessed the medical care by a professional company, Correctional Healthcare Management, for over 11 years, and that's why they are still partners with the Douglas County Sheriff's Office in Colorado. And what it enhanced as well is not only the professionalism, but the control of the county budget.
Rather than my command staff trying to struggle through medical decisions for which they have no background in, they can focus on the things that they were hired to do, and that is run a law enforcement agency.
I really look forward to the future. I think there's a lot of more opportunity to become successful and to provide this quality service that is needed. The incarceration rate continues to grow. Jails are adding on, prisons are growing, and I feel we can help save tax dollar monies again by just growing and being successful in providing quality service.
Ultimately, we'd like to patch together this quilt of regional companies that stretches from the east to the west and the north to the south, so that we have the best possible solution to provide quality inmate health care at the lowest possible cost.
Delivering health care in a correctional facility takes a specialized type of delivery system geared toward this unique environment. The one and only focus of correctional healthcare companies is inmate health care, providing quality care that not only contains costs and reduces risk, but also allows law enforcement officers to do what they do best, enforce the law. For more information, visit correctioncare.com.